A new smartphone device to prevent the most lethal strokes is being trialled by doctors and pharmacists across Australia. And Dr Charles Ovadia is one of the practitioners testing the technology, and he joins us now. Thanks for coming in this morning. How does it work?
Well, it's got a chip that's sitting between two electrodes, and you put your hands on the electrodes and it picks up the pulse rate, the electrical transmission from the body to give us a simple ECG or cardiograph.
So what do you get from that information that tells you whether or not a person might be at risk of stroke?
Well, it's a fairly crude, simple ECG, but it gives us the very important information about irregular pulse rates. And that, I'll just turn this on and show it to you as it goes. So here I am holding it, and once it sees that it's stabilized, it'll take a reading for about 30 seconds. And after that 30 seconds, it'll transmit it via Optus or Vodafone or Telstra directly to a web space where I can view it from my computer. And so it takes 30 seconds for the pulse rate to be registered and about 30 seconds for it to download into my computer in my office.
How can you explain to us the significance? How many people could this help?
Okay. We know this from the statistics that there may be about 50,000 people around Australia who don't know that they've got this condition of atrial fibrillation, which is this chaotic form of irregular heartbeats that predisposes people to getting clots in the heart, which then travel through the circulation and cause a terrible stroke. And people who've got atrial fibrillation get much worse strokes and are much more likely to die as a result of their strokes because of this irregular rhythm.
So it will save lives?
It will save lives.
Thousands of lives.
Thousands of lives. And the importance of it is that it's a simple mechanism to screen. As people become accustomed to it, like taking your pulse and blood pressure, when this becomes more commonly used, it'll be easy to test people's pulse rate fairly commonly, particularly in the high-risk age groups, which are people over the age of 65.
So if you're over 65, can you go to your doctor's surgery and have this test done right now?
Not yet. Only some doctor surgeries are using it. It's still in the research phase. Professor Ben Friedman has done a research study using pharmacists and using 1,000 patients, and he's shown from that there's maybe 1.5% of people who don't know that they've got atrial fibrillation who are in the community. And it's now being trialled in doctors' surgeries to see how best it can be used as a screening tool.
How do you feel about this?
Oh, it's fantastic. It's really so simple because it's exactly what you need from a screening test, something that's simple, that's easy to explain and gives you an immediate result. Imagine if, pap smears or prostate checks are screening tools as well. But imagine if you could just walk into your office, into somebody's office and hold something and it tells you your pap smear is normal as quickly as that. So it's,
well, you start working on that. We'll all be very happy with you if you come up with that one.
Yeah, yeah, so that's what I mean. It's, because it's simple, easy to read, and it's 97% accurate, so that the doctor can be sure that what they've done is pick up somebody who's really at risk, and then send that patient on for further investigations, either something that they can do ECGs and further tests, or send it on to a cardiologist, and perhaps save a lot of lives.
Brilliant. Thank you.